We'll be recording this webinar. I know there are folks who had conflicts and weren't able to make it, and we want to make sure that this is a resource and you'll be able to refer to it or share it with colleagues. So hello and welcome everyone. Thank you so much for joining us for today's webinar on increasing and defending access to reproductive health. Reproductive rights are under attack in states across the country, with conservative legislatures passing bans that restrict abortion, reduce availability of reproductive health care, and limit access to contraception. Localities are fighting back, using this power of city purse strings and their authority to protect constituents' reproductive health. We are thrilled to welcome three speakers today. Alderwoman Megan Green from St. Louis, who's also on the Local Progress Board of Directors, and she's been in office since 2014. And is doing some amazing organizing work that we're excited to have her share. Commissioner Joanne Hardesty from Portland, who took office in January 2019, January 2019. She previously served in the Oregon House of Representatives, and she's the first African-American on the Portland City Council. Finally, Jenny Mistry, the Associate Director of Local Advocacy at the National Institute for Reproductive Health. Jenny will highlight a useful resource, the National Reproductive Health Index, as well as making sure to share some areas to watch for in the federal landscape moving into 2020. A few housekeeping notes. Everyone is muted on the webinar. At the end, we will have some time for questions. If you're dialing in on your phone, you're going to need to email questions to me. The interface platform doesn't give you the capacity to speak. So you can email me at tdunlop@populardemocracy.org. Those of you on your computers can type questions into the chat box at any time, or you can raise your hand by clicking on the hand icon on the lower menu bar at the bottom of your screen, and then we'll unmute you for your question during the end section. With that, I'm going to turn it over to Jenny.
Hi, everyone, and thank you so much, Tarsi. I'm really excited to be speaking with you all today. As Tarsi said, my name is Jenny Dotson-Mistry. I'm the Associate Director of Local Advocacy at the National Institute for Reproductive Health, where I've been working on local policy to advance reproductive health rights and justice for the past 8 years. I've had the opportunity probably to meet many of you at Local Progress convenings before. I've been at several of the past ones over the years, and again, I'm really grateful for the opportunity to share a brand new resource with you all. Oh, and I'm going to now take myself off video so that I can read from my notes and not worry about how I'm looking. So I'll be back. Great. So the National Institute for Reproductive Health, I'll tell you quickly about us. We build power at the state and local level to change public policy, galvanize public support, and normalize people's decisions about abortion and contraception. I'll talk about our partnership model in a moment, but we also engage in public opinion research, which you'll hear a little bit more about at the end. We advance our own proactive policy initiatives, including in New York City and state where we're based. And we build national advocacy campaigns, and we have a C4, the NIRH Action Fund. So I mentioned our partnership model. This is one of our primary strategies, and I should say that we really do focus on proactive work to advance reproductive health rights and justice. We do some proactive defense, but there's a lot of great organizations that do defense already, so we get to really focus on exciting, proactive, and bold new ideas. So we provide funding, technical assistance, and strategic guidance to local organizations in cities and states. And so that sometimes makes people think of us as a foundation. We aren't a foundation. Essentially, we really believe that the most exciting, innovative, impactful ideas come from the cities and states. And we want to be a part of that work, but we also know that part of what makes them really effective and great is when they are led by the people in those communities. So our model is to provide people in those communities with funding and then to work collaboratively with them to help them realize their vision. And since 2008, we've worked with over 175 organizations in 64 cities and 43 states. So we launched the Local Reproductive Freedom Index, the second edition, the 2019 edition, this Monday in Atlanta. And that day I gave this presentation over the course of an hour where I talked almost the entire time. I'm trying to cut it down to 10 minutes. So because I really want to give time for Alderwoman Green and Commissioner Hardesty to share their experience. So I'm going to provide just a ton of information right now. Instead of going into it, I just want to give you all a preview of what's included in the local index. I'll have our website up in a second so you can spend time with it. I'll also give Tarsi these slides to share out, and then encourage you to reach out to me if you have questions about any of it. There's of course time for questions at the end as well. But I realize I'm about to just throw a lot of information at you very quickly, so apologies, but hopefully it's still useful. So the Local Reproductive Freedom Index evaluates the reproductive health rights and justice policies in 50 cities across the United States. It looks at data through December 31st, 2018, so things that happened this year will be tracked in the third edition of the report in 2021. They're not included in this. As we all know, the past 2 years have brought unprecedented attacks on reproductive freedom at both the state and federal levels as a direct result of the Trump-Pence administration, which has then emboldened anti-abortion extremists. And this report, this edition of the report really analyzes how cities have responded. It's, however, not just a look in the rearview mirror at what's been done. We hope it can also be a roadmap to help guide cities as they look to the years ahead and wanting to continue to be real incubators for change and advance reproductive health rights and justice, regardless of what happens on the state or federal level. And what we really found is that cities are leading the charge and rising to the moment to advance reproductive health rights and justice. This is our website for the report, localrepro.nirhealth.org. As you can see on the landing page, you can download a PDF of the full report, or you can explore it. It's all made web friendly, so you can really spend some time on it there. So the report, as I mentioned, looks at 50 cities. For each of the 50 cities are evaluated on 34 different indicators that span a wide range of issues that impact reproductive health rights and justice. So we're not just looking at access to abortion or contraception. We really want to be calling for cities that also will help people that want to have children, choose to have children, and feel that they can raise their children in safe and healthy environments. This doesn't cover everything that touches that, but as you can see, it's really quite broad. We also made it quite broad because we recognize that there are some communities where something like funding for abortion or regulating anti-abortion pregnancy centers might not be politically feasible right at the moment for various reasons. And so we wanted every city in here, regardless of your circumstances or your budget or whatever it might be, to see something that they felt like they could do and achieve. We collected city and county data. We know that health departments are often on the county level. So we looked at both. We prioritized city data, and then we filled it in the gaps with what we could find from county programs. On the scorecard, which I'll show you in a moment, anything that's county level data is marked with an asterisk. If it doesn't have an asterisk, then it's city level data. And for each of the indicators, the possible score could be a yes, which is represented by a check, a no, which is just blank on the chart, limited, which means that either the policy is somewhat in place, but we think it's not quite robust enough to give the full point, or it's only available to one population. So, you know, there's a $15 minimum wage, but only for municipal employees as opposed to for all employees in a city. And then preempted, of course, is if state policy preempts the city or the county from taking action. We look at that as both negative and positive preemption. So if in New York State, for instance, all insurance plans are required to cover abortion, so we don't give New York City credit for municipal insurance coverage of abortion. They have to do that. Similarly, if your city is banned from setting its own minimum wage, then we're not going to penalize you for not having a $15 minimum wage. We put a P on the scorecard and we remove that from the denominator so that it doesn't impact the final score. As I mentioned, there's 50 cities featured in the local index. You can see them all laid out here. In the 2017 local index, which was the first edition of the report, we had 40 cities. We added 10 more cities to kind of fill in the gaps in states with smaller population size. And the first 40 cities were selected based on population size, so that we added in cities primarily in the Deep South and the Mountain West. That information is in the report, so you'll be able to see what the new cities are. So probably what most people are initially interested in, at least, the scores for each of the cities. So while I'm talking, you can see if your city is included here, where it ranked. I want to make 2 notes about the scores. First, if your city was included in the 2017 index, we changed the indicators, not significantly, but enough to where this is not an apples to apples comparison. We added some things, we refined some things. As I've said many times, 2017 was the first edition. We learned a ton by doing that research. Wanted to take this opportunity to take what we learned, make the indicators as appropriate, effective, valuable as possible. So again, the changes in the scores reflect, of course, some movement in local policy, but you really can't just say it's totally apples to apples. We don't plan on changing this moving forward. So in the 2021 edition, we should be able to make a real comparison. The other thing I want to note is that from our perspective, we are not calling out cities. Obviously, we gave a score, but we don't have a list of like number 1 to number 50. You can see from here which city has the highest score and which city has the lowest score. But we wanted to try to avoid, this city is the best or this city is the worst. There's a lot of factors that go into why some cities have higher scores, including budget, size, political circumstances of their city as well as their state. But also, from doing the research, we talked to a lot of Department of Health officials, local leaders, and advocates. And what we feel is that there's a real desire on the local level to do more to advance reproductive freedom. And honestly, that advocates in the reproductive health rights and justice movements haven't always, done a good job of asking people to take action. We see this report as a tool so that now, local officials can really see all of their opportunities, that advocates can see what they can be asking for. And so we really see all of these cities as having opportunities. It's quite different from a state that might have a ton of abortion restrictions, and then therefore if they get like an F on a ranking about reproductive freedom, that's deserved. They're trying to attack access to abortion. We don't see even the lowest score on here as something about opposition to reproductive freedom. It's more just action hasn't been taken. If these scores haven't changed in 5 or 10 years of doing this report, we might change, but for now, we put the stars there so people can get a quick sense of what's going on, but we are not trying to say somebody's the best or somebody's the worst. And so then these 2 images here are really the primary components of the local index. So the scorecard has all of the indicators, all 34 of the indicators, so you can see the full profile of what your city has. It also, we hope, will be a way that, say if you're located in Minneapolis and you want to think about what you should pursue next, you might be able to compare what does St. Paul have that we don't have. Maybe that's a good place to start. Or if you're in a pretty conservative place or a place with a budget crisis, look at another city that's in similar circumstances and see what they have done. And maybe you can reach out. How do you guys do that? How's it working out? So we hope it'll be useful for both of those ways. The scorecards here, I have Portland and St. Louis in honor of my co-presenters. This doesn't have all of the indicators, it's just a selection because you can see we've also added in a local landscape that has, that it doesn't count towards the score, but provides some information, context about the city. And here's our beautiful model city. This is kind of our vision of what a city that's really fully using the extent of its policy powers would look like. We do this for a few reasons. For cities, say, that are already getting a check mark for having a sex ed policy, that's comprehensive, but feel like there's so much more to do. We hope advocates or elected officials can look to the model city. Well, what are the values of like the most perfect sex ed policy? That's what we should be looking for. For cities in general that are higher scoring, this can set further goals beyond just trying to get 5 stars. And we also want this to be useful for people whose cities are not included in the local index. And finally, it's inclusive of things that just don't lend themselves to a yes, no, or limited. Reproductive health care for people who are incarcerated is a good example. It's very nuanced, it's very complex. You can't just say yes, people have it, or no, people don't. So we talk about it in here, but don't include it on the scorecard. Finally, I do want to say we also are making posters of this. So if you want this to hang in your office or to hand out, please email me. And they're not printed yet, but as soon as they're ready, I can send some to you. Policy recommendations. Again, I'm not going to go through these, but we have recommendations for each section of the model city to really make it concrete. I pulled out in this slide and the next one recommendations related to abortion and reproductive health care, because that's what the theme of this webinar is. There's more in there. Again, I'm happy to talk through with people, but I wanted you all to see that in addition to the values of the model city, we tried to offer concrete ideas about what you could do to get towards that model city or to get another point on the scorecard. This is reproductive health and justice beyond abortion access. I'm running out of time, so I'm just saying there's a reproductive freedom timeline that has top 10 things that have been done on this in cities. Sorry, just got distracted. So then, I'm sorry to be rushing through this. Again, I have time to talk at the end, but I want to make sure my two co-presenters have time to speak. We created a self-scoring tool for people whose cities are not included in the local index. You can download a file that will help you calculate your score on our website. In the report, there's an appendix that tells you how to do the research. So we know that there's a lot of cities that are really interested, that want to see how they're doing, and we wanted to provide people with resources. It's already pretty tough to do 50 cities and 34 different indicators. So if you do this research, please let us know what you find. Finally, just a few other tools that we've created. We've created 4 tools to help people use the local index. 2 of them are relevant to you all. One is for candidates, one is for local policymakers. They are also on this website. If you're interested in creating a model resolution or passing a model resolution opposing abortion bans, we have created model language that both opposes bans, but also really affirmative of values that support reproductive freedom. And we're getting ready to publish a toolkit to help people defend against anti-abortion resolutions and ordinances on the local level using a proactive lens. Finally, Tarsi asked me to spend just a moment talking about preemption. I know that many of you are concerned about preemption, passing proactive laws that can bring down preemption from the state level. There are a lot of things that you can still do to advance reproductive freedom, even if you're concerned about preemption. I can't say 100% there will be no preemption if you do these things, but they are a little bit more preemption proof. I'm happy to talk with anyone about specific concerns. Of course, resolutions are meaningful. I think for people to be speaking out is always important. It's linked to culture change, which is something we need to do long term. But I know that they're not always super satisfying, but of course they can't be preempted. Clinic protection ordinances that defend against protesters or noise in a clinic might be able to be preempted. It's unlikely. You are likely to be sued if you pass one, but that's different. You can also train law enforcement on existing state and federal laws and ensure that they're enforcing them appropriately. Some restrictions on anti-abortion pregnancy centers, including restricting county funding or restricting deceptive advertising, or also public awareness campaigns about what anti-abortion pregnancy centers are and do, are all possibilities. Training providers on how to provide LGBT-friendly care to people that need reproductive health care or teen-friendly care is an opportunity. Also training people in the judicial system about how your judicial bypass process works for young people who need abortion access in the states with parental notification requirements are like administrative things you can do to increase access. Abortion Provider Appreciation Day is March 10th. Your city could consider recognizing that officially. And that's another stigma-fighting culture change piece. Public awareness about abortion access. If you're in a state where a ban has passed saying abortion is still legal here, we support your right to access abortion. Here's where you can get it. Here's what an anti-abortion pregnancy center is. And then any anti-stigma work, talking about abortion, talking about contraception, saying the word, engaging abortion providers, you know, touring a clinic, anything like that. Again, we need to work towards long-term culture change to combat the battle to come, and that they can't stop you from doing that. Next steps, I'll just say we're offering local trainings to advocates and officials if you're interested in that, and please reach out to me. And the 3rd edition of Local Index, October 2021, it will reflect data through December 31st, 2020. You have about a little over a year to improve your score. And I'm happy to answer questions about that. I'll be back in the end with more info, but want to now turn it back to Tarsi.
Awesome. Thank you so much, Jenny. Really appreciate it. And if you're interested in getting a poster, or if you're interested in the training or any number of things, please reach out to me and to Jenny. Her information will be on the end slide. So with that, I wanted to go ahead and turn it over to Megan Green. Megan is a fantastic advocate for reproductive health access in St. Louis, and she's going to share some of the lessons learned and the organizing work that's happening on the ground. Megan?
Thank you, and thanks for inviting me to participate in this today. So St. Louis has some very unique challenges when it comes to reproductive health care. We are a blue dot in a very, very red state where we have a Republican supermajority and a state legislature and a governor who has vowed to make Missouri the most pro-life state in the nation. And there's been a lot of very intentional work at the state level that's been done to actually make this the case. So a lot of what we have been doing in the past probably year in particular is a lot of awareness building and organizing. Missouri is at a place where we are down to one abortion clinic in the entire state, and that abortion clinic is in the city of St. Louis, and it has been the goal for years for our state government to try to shut down this abortion clinic. So not only have they been, passing abortion bans, but something that we've seen here that has been very disheartening and alarming is the politicization of our Department of Health. So our state Department of Health sets out regulations for healthcare facilities. And what they have done now at the state level is they've tried to deny the license for our last remaining clinic to operate, citing that we are not meeting health and human services standards. And basically they are requiring doctors here, if we are to stay open, to perform unnecessary pelvic exams on patients. We have a 72-hour waiting period in the state, and so they are mandating that doctors perform an exam when a patient comes in first, and then have to do a second exam 72 hours later. And medical professionals over and over and over again has said that this is intrusive, it's not necessary, and have actually labeled this state-sanctioned sexual assault. But our head of the Department of Health and Senior Services, who has been an anti-abortion activist for decades, has been working to make sure that even without the legislature, they are able to shut down this clinic. So we've done a couple of things. First, a lot of people in Missouri had no idea that we were down to one abortion clinic and that we were on the verge of closing. And so one of the first things we've needed to do is really build advocacy and awareness, and do so in a way that could get some not just local and state attention, but national attention to what was happening here. So the board members for Planned Parenthood and myself and a couple of union leaders, we helped organize a very massive protest here in the city, where we had about 1,000 people come out to a rally, but then a couple blocks away from the rally, there were a group of us who went in and basically occupied the governor's office. And we were able to do so for actually 3.5 hours before we were arrested and carried out of there. But engaging in that massive form of protest actually changed the narrative in Missouri and woke up a lot of folks who had no idea how dire things were in our state. And so that is now opened a door for us to be able to do some other advocacy work, because we've changed the narrative and we've built some awareness that that wasn't there before. One of the things that we did locally a couple of years ago is we added pregnancy and reproductive health to our non-discrimination ordinance. And we were the third city in the country to do this. And the governor in Missouri actually then called a special session on abortion, citing that he needed to overturn what we had done in the city of St. Louis and basically punish us. So he called a special session, made all of the General Assembly come back in to overturn this ordinance. And the funny thing was, what they ended up passing at the state level really didn't do anything. And it didn't end up preempting our ordinance because they didn't really understand what we had done. What we had done is just like, other non-discrimination ordinances, we basically just said that you cannot be discriminated against, you cannot be denied access to housing or to employment based upon your reproductive health decisions. So say your employer is anti-choice and finds out that somehow that you've had an abortion or you are using contraception or IVF or something that they don't agree with, your employer would not then be allowed to fire you for that, and your housing would not be able to deny you access. And that was particularly pertinent in the city of St. Louis because we have a very large number of Catholic nonprofit-owned housing, particularly for low-income folks, and so we wanted to make sure that we had those protections in place. So after the state passed this so-called preemption that didn't preempt us, they actually figured out a couple of months later that they didn't do anything to our local ordinance. So then they actually sued the city in order to invalidate parts of it, and they were successful in negating parts of the ordinance, basically citing religious liberty and religious freedom. And so churches are exempt from it. Other religious institutions are now exempted from it. And so it did gut some portions of it. I think another important thing to kind of think about while we're from sort of a systems point is the attorney who sued the city to invalidate this ordinance is now Trump's appointee to the federal bench. And is now going to be our new federal judge. And so there's this very coordinated and orchestrated effort that's happening at every branch and every level of government in order to undermine any kind of local gains that we're getting. So we've had to turn our attention to a couple of other avenues, not just protecting and building awareness to keep this remaining abortion clinic open, but we also have a proliferation of these anti-abortion pregnancy centers or fake pregnancy centers that have been popping up across the state, and one of them has opened a block away from Planned Parenthood, and they do not provide medically accurate information. They're under no obligation under state law to provide medically accurate information. And in particular, they actually lie to folks. And so so some of the organizing that we're doing here is we found out that not only do these fake pregnancy centers lie about the healthcare options that they're giving, they're also in our schools, and they're providing the sex ed curriculum for a lot of the school districts in our area. So we've been able to do a lot of parent organizing as well. When parents get word that they are, in public schools, their kids are being taught this very religious, shame-based, sex education, they're pretty appalled by it. And so there's a group here called Expose Thrive. Thrive is the biggest anti-abortion clinic that we have here, and have been successful in getting this curriculum out of, I think, 5 school districts so far, and that number is continuing to increase as we're doing that organizing. I'll just say one kind of last thing, before this and or before I end, about the crisis pregnancy centers. In our state, they are also getting TANF money, so money that is supposed to be going to feed, low-income kids is getting funneled into these crisis pregnancy centers. And so we're working on some local efforts that would require that these facilities provide outside documentation, signage, that they don't have medical professionals, that and also educating a lot of folks in our public school system that money that could otherwise be going toward feeding hungry kids is essentially getting diverted into these anti-abortion clinics. And we're hoping through some of that ongoing organizing that eventually we can get this money redirected back toward where it needs to be. But the last thing I'll say is, when we are a red state and we are, very much in the minority, the biggest thing that we can do as a city is kind of use that bully pulpit. And in some cases not be afraid of preemption, because even if we do get the pushback, it also raises awareness and wakes up folks that agree with us. And what we're hoping to work toward in Missouri in 2022 is a statewide ballot initiative actually protecting abortion rights. And we think we're starting to be able to change the conversation and change the narrative enough to be able to get us there. But there's a lot of challenges of doing this work locally, especially in heavily red states. But I'm happy to, at the end, answer any more questions about that, and I'll turn it back over to Tarsi.
Fantastic. Thank you so much, Megan. We'll be excitedly looking towards 2022. I want to turn it over to Commissioner Hardesty from Portland, Oregon, to talk about some of the forward-looking proactive work that they're doing in partnership with the state as well. Commissioner Hardesty?
Thank you so much. I greatly appreciate the opportunity to be part of this conversation. Before I start, I want to make one minor correction to my introduction. I am not the first African American to serve on the Portland City Council, but I am the first African American woman, and the last man served 17 years ago. So I just wanted to set the record straight about that.
Thank you so much.
You are very welcome. I want to say that Oregon has been really revolutionary in protecting a woman's right to choose and have control of her body. I, as a former legislator and as someone who currently serves on the city council, know how hard Oregonians fought to ensure that we had comprehensive health for women and others who could become pregnant. And so what I want to do is go through a timeline and then end on the resolution that we recently passed at the Portland City Council. And so I remember starting this work back in 2014 as part of the Oregon Health Equity Coalition. And the coalition came together to ensure that women of color were centering the conversation about what their needs were throughout their life, what we say from birth to grave. So it was important to us because in a state with small numbers of people of color, African Americans make up 2% of the state population and 6% of the city of Portland. So living in a state with very few people of color, it was really important that we together decided how we were going to make sure that our needs were met. We had strong advocates. NARH has been very strong and very powerful in Oregon. However, the approach has always been from a white middle-class woman perspective and really didn't reflect the voices and experiences of people of color, immigrants, refugees, and others who have different experiences when they show up for healthcare. And so in 2014, we got funding from the Northwest Health Foundation to intentionally create a coalition that would really talk about and develop policy that we could ensure our communities would have access to. And so we spent a year actually building a campaign, just like any other issue campaign, training our people, making sure that we spoke in a united voice about what it was we were attempting to accomplish. We spent 2015 going to the legislature to talk to our representatives and state senators about why we wanted them to pass this legislation. And so this was 2015. Oregon says that we are a pro-choice state, but what we encountered when we showed up to get this legislation passed were pro-choice legislators that would whisper to us, well, don't say the word abortion in this building. Don't put the word abortion in the bill, right? Now, as a former legislator, I understood if the bill didn't say abortion, it wouldn't cover abortion. And so we were just kind of appalled. We're like, how can we be at a legislative body with a majority of people who on all their campaign literature say they're pro-choice, and yet they can't even say the A word in the building? And so we lost. We did not win in 2015, but we did not take it as defeat. What we took it as an opportunity to hold our pro-choice legislators accountable for their non-action on a bill that was vital to communities of color. And then lo and behold, the next legislative session came. Oh, wait, I just jumped too quick. Then there was an election in between the time we did not win this and the 2015 legislative session. There was another election cycle, because apparently they come every 2 years. And so we held legislators accountable. So we said, being pro-choice is fine, but were you a champion? Are you a pro-choice champion? And what does that look like? And so we did not do our normal process where we basically endorsed people because they said they were pro-choice. They had to prove that they were actually champions, right? Because what we realized was if people can't even say the word abortion, then how pro-choice can they really be? So there were very few endorsements given out. I was part of the NARAL PAC. And so as a former legislator, they couldn't wiggle through the conversation. For example, they would say, oh, I'm sorry, the speaker would not give me the bill. And I knew as a chairperson, they could hear any bill they wanted to. So we were able to remove those reasons for why they did not act on what we thought was the #1 critical bill that session. So lo and behold, 2015 comes, and legislators are falling over themselves to be co-sponsors of our bill. So the Reproductive Health Equity Act of 2017 was introduced as House Bill 3391. And what this did was codify into state law that safe and legal abortions in the state of Oregon would be available and accessible for every person who can become pregnant that needs access to the full range of safe, affordable, and comprehensive reproductive health care services throughout their life, including but not limited to screening for cancer, sexually transmitted infections, contraceptive services, abortion care, prenatal care, labor and delivery services, and postpartum care. In addition, this bill also ensured that immigrants, refugees, transgender people, and gender non-conforming individuals would also have the full range of health care to meet their needs. And then, so we celebrated. We're like, yes, 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 life is good. Oregon, we have done what we thought we needed to do. And then, of course, there was an election. And then there was these changes at the federal level. And then all over the country, we started seeing that there were people who were being denied access to safe, affordable abortion. And it wasn't enough for us to rest on the fact that people in Oregon have that right. They are safe to exercise that right, regardless of whether or not the Affordable Care Act continues to exist. We had taken care of Oregonians, but we also have a responsibility to speak out loudly and clearly every place we possibly can to ensure that this right continues for every person that can become pregnant in every state in the United States. So what did we do? We decided that we would pass our IA decided that I would introduce a piece of a ordinance at the city of Portland. I'm sorry, a resolution that would clearly state that we were in support, unequivocally, we condemned any attempt to restrict, prohibit, or otherwise impede access to safe and legal abortion care. The resolution also stated that access to safe and legal abortion services is vital to the health of people who can become pregnant and our broader community. The city of Portland remains committed to eliminating stigma surrounding abortion so that every person in our city who makes the choice to access safe and legal abortion care will feel supported, welcome, and safe doing so. But in addition, the resolution directs Portland city attorneys to build a coalition of attorneys from other cities that have strong abortion access so they can file amicus briefs and provide further legal support in the future if necessary. In addition, we made sure to highlight Ohio and Alabama and to ask our attorneys to provide whatever legal assistance they could to fight back against those new restrictions. And at the end, I would be happy to share our city attorney's phone number and contact information because she is ready, willing, and able to work with any state who wants to access her for this purpose. And I'll stop there.
Thank you so much, Commissioner Hardesty. And we'd love for you to share your contact information, and I will also share it in the follow-up email for individuals who registered for the webinar, and you can think about how that might be helpful to you in your municipalities. With that, I'm going to turn it back to Jenny to speak for a few more minutes about the landscape moving into 2020, which I know is an issue that is extremely pressing and sort of top of mind for everyone. And then we'll have a few minutes for questions. Again, you can go ahead and type them in the chat box at any time or email them to me if you're dialing in on your phone at tdunlop@populardemocracy.org. And with that, I'll turn it back to Jenny.
Thank you so much, Tarsi. And I wanted to say I realized that some people are only on their phone and can't see the slides right now. So when I'm saying, here's the policy recommendations, you could read them while I talk. That's not super useful for you, but hopefully you can get the slides afterwards. And again, let me know if you have questions about them. I wanted to spend just a few more minutes talking about the future of Roe and just touching on messaging research. I mentioned at the beginning that NIRH does public opinion research, and if you're interested in diving into this messaging or learning more about how we recommend talking about reproductive freedom, again, this is me kind of previewing what we can offer to you. I guess I'm doing messaging first. So sorry, I thought I was doing future of Roe first, but it's last. So messaging. This messaging triangle is our overarching recommendations for talking about abortion. So in the center is when someone decides to have an abortion, it should be safe, affordable, and free from punishment or judgment. This is how we recommend going into a conversation about abortion. This is based on research from 2015 to 2017, qualitative and quantitative, this and everything I'm going to be talking about. Focus groups in 10 states with a range of political environments. We talk to people with a range of views on abortion, although nobody who is opposed to abortion being legal in all cases. So what's really just important about this message is that by saying when someone decides to have an abortion, you kind of take away the instinct that some people have to want to question people's decisions. It's saying, this decision has been made. What experience do you want the person to have? And as you'll see towards the end of these slides, people really are all in agreement that if someone is going to have an abortion, that they want it to be safe, affordable, and free from punishment or judgment. Decides is the other key phrase here, as opposed to chooses. Decides just test better, chooses feels a little bit more I guess, like, people feel a right to judge a choice someone makes versus a decision, or that one is less serious. And you can see our vision and our solution here. With increased threats to abortion care, we need to ensure that abortion care remains safe, legal, and accessible. So that's the overall takeaway. That message in the center is the one that I really want to leave you all with. Here, again, I don't want to fully talk through all of this, but we hope that we can offer some new messaging that's updated and reflects, how people think about these issues now. Instead of saying pro-choice or pro-life, we say supports a woman's decision, supports abortion access, someone who is an abortion supporter, and we use anti-abortion or opponents of abortion opponents. Commissioner Hardesty said it best: say abortion. Don't say, women's health care. If you mean abortion, then say abortion. It's important to make sure it's included in policy, and it's important to stigma, to fighting stigma. And you can see other reasons here, other tips here. We have more on the next slide. Abortion should be safe, legal, and rare. That was in the news this past week after the Democratic debates. We recommend saying legal abortion must be available and affordable. And if you have time or you feel appropriate, adding in without shame, pressure, or punishment. Let people make the decisions that are right for them, as opposed to putting a value judgment on when someone makes that choice or when it's appropriate for someone to make that choice. We love government, so we don't want to demonize government. That's probably less of a problem for people on this call than advocates who sometimes are like, politicians are doing this. But we support government. We think it has an important role to play in people's lives. So we say some policymakers or special interests want to impose their values. We also think you don't need to talk about how sad or difficult or heartbreaking abortion is. It is for some people, and it isn't for many. It's complex. People experience it in different ways. The most common emotion people feel after having an abortion is relief. Not only is that like really continuing to put stigma on the procedure, but I think for people who have had abortions and hear those messages, it can make them think, this isn't how I experienced it. I don't feel included in this messaging. Saying we don't know everyone's circumstances and saying that this is deeply personal, all of that is an okay way to talk about it. And 1 in 4 women in this country will have an abortion in her lifetime. So it's all types of people who have them. Some women or those women or things like that doesn't really work. And one thing I'll just flag here, or 2 things actually: fairness, unfairness. People don't like that. When people hear fair, they think, well, life isn't fair. And it really turns them off. So we say, we should not treat people differently because of their circumstances. And then a really common thing when we talk about the future of Roe, we can't go back to pre-Roe days where women are going to die. It's not going to be good if Roe is overturned. That being said, the technology that allows access to abortion is different now. What people will probably end up doing is ordering pills off the internet, as opposed to the hangers that we think about. Dying from back alley abortions, there will be people that will die, but it's not going to be, it's going to look different if Roe is overturned now than it was. So we recommend we all want to be able to live a safe and healthy life and be free to define our own path. Just a very affirming message. Happy to talk offline with people who have questions about that. And again, 94% of people that we surveyed wanted people who are seeking abortion to have it be informed by medically accurate information, safe, respectful of her decision, legal. 68% don't want a person to feel shame. That's a really high number. So we talk about how people support abortion access. Here you can see that people support a positive abortion experience for people who have decided to have abortion. And then this is my last slide. So I wanted to just talk, because I know people are always thinking about what's going to happen to Roe. And, we do think it's quite likely that at some point soon, maybe not this term, possibly this term, Roe will be gutted or overturned. And gutted means that while it will still stand on paper, that in reality, abortion will be able to become completely inaccessible in some states. What I want to say, first of all, is that for many people, particularly people of color, people who are undocumented, young people, trans people, people who are low income. Abortion is already very inaccessible. Roe has been severely cut back. I think from hearing from Alderwoman Green about how there's only one clinic in Missouri documents that. So people that don't have resources already struggle to access abortion. That's really important to say. If people ask you about it, it's really important to make that clear. That being said, abortion is still legal. That's also important. None of these bans are in place right now. But we need to recognize as we're thinking in cities about what we want to do to protect abortion, what could be happening in the next few years. First, I think it's always important for cities who are home to abortion clinics to embrace that status, be proud that you're home to a clinic, that people can get comprehensive reproductive health care in your city. Or if you don't have a clinic, consider how could you welcome a clinic to come to your community? And I'm, again, happy to talk about that. But in the short term, so this is right now, before Roe is overturned, we think it's important for cities to declare opposition to bans, especially for cities, as I said, in states where the state has tried to ban abortion. Make sure that residents know it's still legal. After, for instance, Georgia tried to ban abortion, we know that people were calling New York thinking that it was already inaccessible in their state. And partner with providers to lift up where people can access abortion care, and always a priority is to keep patients and providers safe. In the medium term, as in after Roe is overturned, especially if you're in a state, again, where now a ban would be going into effect, we think that cities need to be thinking about how they can help people move to places, access care in places where abortion is still accessible. That can be establishing relationships with another city. And then keeping providers and patients safe. Again, always keeping that priority in mind, but really preparing for a time when we'll need to have the responsibility of helping people travel. And states cities like Portland or New York need to be thinking about how can we receive more people and welcome people to access care. And in the long term, I talked a lot about resisting and culture change. Again, I know that talking and resolutions are not always that exciting, but we really do need local leaders like yourselves to say that this is not okay, to continue to run for office and support us, and eventually work towards a time when Roe will come back in place or something even stronger. That's our vision for the future Roe. Again, happy to answer questions. I've said a bunch of times you can contact me offline, so here's my contact info, and Tarsi will make sure that those on the phone have access to it as well.
Yeah, absolutely. Thank you so much, Jenny. And for those who are on the phone, we know that there's a lot of information that we threw at you that was on slides. So we've recorded this presentation. The recording is still going successfully. So we'll be able to upload that and share out the link in the next week or so. So I wanted to open it up for questions. You can type into the chat box or raise your hand, and we'll work on this technology situation for unmuting. If no one has a question, then I think Jenny probably has one that she would like to ask. But we'll give folks a second here. Oh, I see a chat in the chat box. Sarah Lebnin from Hayward, California. Are there specific policy recommendations for cities?
Yes. We do have some. I just went back to the slides. Sarah, I don't know if you can see it or not. We do have a lot of specific policy recommendations depending on your city's circumstances. Funding abortion care is really important, particularly, again, for low-income people, people who are on Medicaid, or people who are uninsured or undocumented and don't have access to insurance. Austin and New York City allocated funding in their budget in New York for abortion care directly, and Austin to help people travel or pay for associated costs because they are preempted. And so that's a really impactful thing that you can do. Even in a place like California that I know has a very impressive safety net, there are people that fall through the cracks for various reasons, and additional funding to abortion funds, or that the city would allocate itself to residents in need, is really, really meaningful. And certainly in places that are not in California, there's many more people that need that support. Abortion funds are where people usually turn. We think government can fill that role. Addressing the deceptive practices of anti-abortion pregnancy centers in many different ways, but I would say public education about what they do is really important. If you have a clinic in your community, understanding if they are facing harassment and how you might be able to pass an ordinance or work with law enforcement to protect them. That can also include residential picketing ordinances, because people do picket outside the homes of people that work at abortion clinics. So it's not just about the clinic, it can also be about where people live. The Reproductive Health Non-Discrimination Ordinance that Alderwoman Green spoke about will protect people from discrimination based on their reproductive health decisions, including abortion or the choice to use IVF or contraception. I'm excited to get some cities to officially recognize March 10th as Abortion Provider Appreciation Day. Let me know if you're interested in that. And then judicial bypass is the process by which young people who can't talk to their parents or their guardians about the need to have an abortion, but who live in a state with parental consent requirements, not California, of course, need to go to judges to get approval. And there are ways that you can work with the court system in your community to ensure that they're friendly to teens, that teens know what their options are and how to navigate the system. These are just a few ideas, but some of them, and then we have policy recommendations here, not related to abortion, that you can see up here, in particular health and support for people who are incarcerated, especially while pregnant, banning shackling in your community for people at any stage of pregnancy, offering reproductive health care in school-based health centers, ensuring that you're not stigmatizing pregnant and parenting youth in sex education or campaigns, but instead just helping people make the decisions that are right for them. The local index has a range of recommendations based on what you're interested in.
Awesome, and we'll be sending these slides around and along with the recording, so you can definitely refer to these in more detail. Thank you for the question. Are there any other questions from anyone? We're almost at the top of the hour and we'll probably wrap up, but I want to make sure that we don't miss anyone. All right, well, it looks like we don't have any more questions. So with that, thank you both Commissioner Hardesty and Alderwoman Green for your incredible work and for sharing some details with our network. And Jenny, thank you so much for pulling this together with me. I really appreciate our partnership. If anyone is eager to move forward on any of these recommendations or talk more, Jenny's a fantastic resource and is super accessible. And Jenny, if you could flip back to the final slide just at the end, that'd be great. And so I encourage you to reach out to her directly, and we'll be in touch via email very soon. So thank you all for your time and have a lovely evening.
Thank you.
Thank you so much.